So imagine you're a 13 or 14-year-old young man or woman or a member of the transgender community questioning your identity. And you tell your parents that you need help. And they say, we're going to send you to a psychiatrist to change you. Is that legal? We asked that question of our next guest, Deborah Cooper of Gaylesta. Deborah, welcome.
Thank you.
Well, before we answer the question, for our audience, tell us, what is Gaylesta and what does that name stand for?
Gaylesta was formed in the 1980s, and it stands for Gay Lesbian Therapy Association. But of course now we're much more inclusive. We have much more letters.
Right. LGBTQ, right.
Yes. So we are an association of therapists who are LGBTQ friendly. And who work with the mental health of our community.
Right. Now, Gaylesta is specific to Northern California, or?
It's specific to the Bay Area right now. We're hoping to go statewide at some point.
Right.
We're the biggest organization, association of LGBT mental health professionals.
Well, let's get to the question. I'm that 13, 14-year-old young man or woman, and I go through the rigmarole of telling my parents, I've got some issues, and they say, great, we're going to send you to a doctor, and he's going to change you. Is that still legal? It sounds so 1968 or something.
It is absolutely legal at the moment. By September 30th, it may be illegal. Gaylesta has been working really hard we helped get this bill into the California Senate, and it went through the Senate and the Assembly. It's on the governor's desk right now to make it unethical and illegal for psychotherapists to treat homosexuality as a disease for minors.
For minors. Now, at the time of this taping, this is before September 30th. So hopefully by the time this airs, this will be law. Is this the sort of law that is, on governors' desks all across the country, or is once again California leading the way with LGBT issues?
This is landmark. And it has, it's just been incredible what's happened across the nation, because of course LGBT organizations have just really supported us and spread the word. There's now a bill in New Jersey that's before their state government to do the same. I think it'll spread. But I am very, very proud to say that we really were part of creating this bill, and it will save lives.
I'm not a legal expert, but I have been a homosexual for 50 years, and I seem to recall something that in 1976 the American Medical Association took homosexuality off the list of psychological disorders. So how is it 40 years later we're still treating something that the Medical Association says isn't treatable? It's
crazy. Okay,
pardon the pun.
Pardon the pun, it's crazy. But we are fighting that. We are still really in a battle of what is the disorder, homophobia or homosexuality. And I think a lot of Gaylesta, our members got radicalized because one of the professional associations, California Association of Marriage and Family Therapists, in the last, I think it was 5 years ago, basically was taken over by the right wing. The president of the board was a Christian counselor. They were not backing Prop 8, and they were definitely putting out the word. They were definitely promoting the idea that homosexuality was a disease. We fought that battle hard. We won to get to change that. But the American Christian Counselor Association is growing by leaps and bounds. They're going through therapy schools. They're getting licensed, and they are promoting their agenda.
So now, as a private nonprofit or association, they can promote anything they want. They can say that the universe was created by a spaghetti monster, and we're flat as far as a planet. It doesn't have any basis in scientific research.
None.
So now, once this law is passed and hopefully signed by California Governor Brown, what will be the result? Will these Christian groups then have to listen to that, or will they find another out based on...
They can get their license taken away, and that's what we need. We need to be able to have it be unethical and that your license is on the line, because having licensed therapists who treat, let's face it, not even minors, but anybody for being a homosexual and treat it as a disease, it's wrong.
Right. Now, I imagine that there may be some groups who, let's say this bill passes, that are no longer able to say, well, I'm treating you because homosexuality is a disease that can be treated and we can change you, but now I'll just take off that hat and put on my ministry hat and say, my religion says that what you're doing is wrong, so I'm going to seek to change you through spiritual means. Will that still be possible? I.e., will people still be able to take this 13 or 14-year-old young man or woman and tell them that they are diseased somehow just because of, as the president said, who they love?
Not licensed, not licensed therapists, right? Not anyone who's actually in the profession.
Right.
The ministers still, they could have a pastoral counseling. Actually, I'm not sure on that, but I'm pretty sure, I mean, I know for sure that anyone who is an MFT, is a psychologist, is a psychiatrist, this is a big nail in the coffin of these kind of treatments.
Now, you said that this law will actually save lives, and I guess that refers to, I believe I'm correct in these statistics, that the incidence of teen suicide is much higher for LGBT youth than it is for the general population. Is that true? And what are some of those statistics?
It's absolutely true. I'm a terrible number person, but it is absolutely true, and it is also true that not only is the incidence of suicide higher for LGBT youth, but it is way higher for LGBT youth who go through these treatments.
Right.
Right.
How did you get involved in Gaylesta?
How did I? Well, first I was just on the. I signed up. I was just to be referred to, right? And then
as a licensed therapist.
As a licensed therapist. So
right.
I was on the referral. We all have our own webpage on the website, gaylesta.org. And then I got really radicalized by finding out that how much the right wing was really making inroads into our profession. So I got much more active. And then I I started an advocacy committee in Gaylesta, and then I became co-president.
Right.
So that's what happened.
Now, correct me if I'm wrong, but the issue of who is a minor and who is not is different state to state, correct? Or is is the cutoff 18 for everybody? I mean, could a 17-year-old high schooler be called in to right now a therapist who says, I'm going to change you into a heterosexual?
Well, right now, a 12-year-old, a 13-year-old, but after, when we have victory on this, anyone under 18, no.
Right.
No.
What has been the most difficult story you've ever heard from a young person about this?
You know, the most difficult story is actually from parents who've lost children, and hearing. Our advocacy committee met on Monday, and someone was telling a story of a mother who now wants to speak out because she put her son through these treatments and he killed himself. And when you lose your child, and you took them to a professional. I mean, that for me is just heartbreaking.
Right.
It's heartbreaking.
In our last few moments, do you have any advice for any parents who may be watching this and or young people who maybe are questioning their sexual identity or think they have a child who needs help? Any advice as to what they can do, how to handle it?
Go to gaylesta.org and find a therapist who works with families, and find a therapist who can help everyone accept who they are, and I believe in good therapy.
Right.
Bad therapy
and bad legislation. Yeah. Not a good mix.
Not good.
Thanks for being on the show.
Thank you.
We've been speaking with Deborah Cooper of Gaylesta. Next up, we will meet Heather Holt-Villiard, Executive Director of ArtSpan, producers of, well, one of the most exciting arts events anywhere, and we've got it right here in Northern California, the annual Open Studios. We'll be right back.